Indeed, it's a heartening moment for us to see confluence of great minds and achievers coming together for this initiative. Dr. Daksha Shah, with impressive qualifications and accomplishments and 3 decades of experience in BMC, is now the Executive Health Officer, Public Health Department, working on multiple challenging health initiatives. Her lead role in Project for TB Care, formulating policy guidelines, and being a faculty passionately contributing with contemporary ideas and projects in the area of awareness and non-communicable diseases have received accolades from the medical fraternity. Put your hands together to welcome Dr. Daksha Shah. It's indeed a special moment for us to look for, and we look forward to her special address as well.
Thank you, Mr. Sundar. That's really awesome. So, respected dignitaries on the dais, all my friends and colleagues from IMA. Indeed, it's a privilege for BMC and for me to be part of this unique initiative of IMA. I think I've been seeing that IMA is always in forefront of, starting something new. And this being a very critical public health action, which now IMA has initiated. When Dr. Ketan Mehta invited me some 1 month back to be part of this seminar, in fact, I went down the memory lane. Exactly 10 years back in 2013 and 14, I was in US doing my fellowship in public health policy. And I was placed in PAHO, that is WHO regional office in Washington, DC. And my topic and my task assignment was salt reduction module for medical officers. So, so it was in 2013-14 that I was exposed to the strategies of salt reduction at a population level. I didn't know anything. I was just talking, we in India, we talk about the hypertension control, this control, that control, but we never think of a population level reduction of certain things. So I was exposed to these strategies at that time in 2013-14. And of course, the module was to be written for the Americas. These countries are basically all these Mexico, Argentina, Peru, Uruguay, and all those countries which is in the south of America. And this module was written for those medical officers working in the health centers. Also, I got an opportunity to work with that urine excretion and, deciding the levels of urine, salt in the urine and etc. My mentor was Dr. Branca, and she was closely associated with all the food industry over there, and they were at that time deciding the salt levels of certain categories of food. So I happened to attend some of those meetings of PAHO where actually the industry was talking with government, the US, FDA, and these all participants were there and they were talking, the bakery industries were there, and they were talking about reduction of salt and how gradually they will reduce. So these voluntary targets were discussed in those meetings, and way back in 10 years back I got, of course unfortunately when I came back I couldn't work on this. So when Ketan Mehta invited me, I was like delighted. Okay, yeah, now somebody is talking about salt. So of course, I would like to share with you, our commissioner is coming soon. Some of the initiative BMC has already taken. We are doing a screening program, in our health centers. We have strengthened our primary health centers. Everybody who is 30 plus, walks in, we check for the blood pressure. Even our CHVs and ASHAs, they go house to house. Every Wednesday, we have this screening program. Dr. Rajan has mentioned about the Chennai, Salt Congress. You have also mentioned about the school program. So we are also having certain school programs in Mumbai where, eating right, that campaign we are already implementing in all our schools. Some of the other initiatives like with Jamruk Patel over here, with the Dietetic Association of India, we have rolled out, the dietitians program, which is one of its kind. All our dispensaries now have dietitians visit. They counsel the patients not only for diabetes, but for hypertension also. So these are some of the initiatives, and I'm very glad to announce here that very soon we are launching a campaign for salt and sugar reduction in Mumbai, at least. So when I saw this, the salt fight, it's really nice, unique slogan, and of course we'll partner with IMA and Resolve to Save Lives, and we are also partnering with the Healthy City initiatives with the US and all. So now coming back to the salt, we all know, we all eat two ways. more salt than what is expected, double. We did a WHO step survey in Mumbai in 2021, and we found that the hypertension prevalence is around 34% in Mumbai. And we also did this risk factor survey, that is how much is salt we consume. So we got this, urinary studies, and we got this around 8.9 grams. So around, say, 9 grams we are consuming as Mumbaikars, salt in here. So definitely, the question is, where is this salt coming from? Of course, the cooking and all that, it's a normal. So 60 to 70% salt comes from your processed and packaged food, basically. And we all know that in this lifestyle, what has been changing, we have just click away all our, online platforms like Swiggy and Zomato. The children have so much of access, online payment, ho gaya. Pizza, pasta, kuch bhi order karo. I mean, you name it and the children have an access. They don't have to ask the parents nowadays. It's just an, click and you get the order. So much of access to unhealthy food. Now to counter that, we have not done anything to give access to the healthy foods. I think we need to do this as a government or as a community. Government of India, I'm sure that have rolled out very good targets. The target is to reduce the salt intake up to 30%, sir, if I'm not wrong, by 2025. And there are certain strategies. The first important strategy is to promote the healthy food. An Eat Right campaign of Government of India, I think you might be aware of, is been there already. FSSI has been also working with us and the government. Second important is the awareness of our consumers. So food labeling. Read the salt content of the food, and now most of the food has the salt labeling. And the most important is to involve the food industries, the restaurants, the packaging industries, and to give them the targets of reduction of salt in their packaging. So of course all these things is going to happen. It is not that easy to do, because when you want to do at a population level, it's of course not going to be easy, but certain countries has already achieved. Like if you look at US, the New York City Health Department has done this. They have this community program where salt reduction in communities with the schools and with the old age homes and so many other setups. Also there voluntary reduction of salt targets which has been given to 150 kind of categories of food. Finland has done, I was just going through some literature, then Finland has done this tremendous work where they have already given this salt reduction targets to the industry, and almost I think their hypertension rates have gone down to up to 30%. UK is one of the best program of salt reduction, and over a decade they are able to reduce 15% of salt intake in the community. So this is some of the examples in front of us. Of course, just to come to a conclusion that reduction of salt in your diet is not just an individual choice. We think now it is an individual who is responsible. No, it's a systematic change which we require. So it requires the partnership. It requires a multi-stakeholder partnership of government and BMC, partnership with the physicians, all of us, as a primary care, as a consultants, all of us, and also the food industry, and of course the citizens per se. So all these four pillars has to be there in this partnership. And of course we need to work on the communication campaign. How do we make these people aware? Community engagement, and then the policy interventions. So all these things put together will, I think, somewhere maybe 5 years, 10 years down the line, we'll see this change. So I think this is a good beginning. I wish IMA's endeavor a very good success, and I look forward that how we can participate in this, and I'm sure that these key challenges which are there, we all will together will come across. We will definitely take care of it, and with the so much of knowledge and so much of understanding and so much of data which is now coming up, we should be able to do something in this space where we can protect our general children and our young population. So with this, I thank once again IMA, and I really applaud your success, and I really applaud your initiative. So thank you very much.